Hello and namaste everyone. I am Shubham. Today I am come with my new video. The topic is a skill of helping a patient to deep breath and cough. So let's talk about this topic. Deep breathing and coughing clear the air passes to prevent respiratory complications. However, they increase discomfort when the patient has a new incision. You can best assist the patient by checking to see if pain medication is needed before the exercise. If so, wait 45 minutes after the medication has been given before carrying out the exercise. Learning how many deep breath and cough should be attempted. The usual number is 5 to 10 breath and 2 to 3 cough. And using a pillow or binder to support the incision during the procedures. Now I demonstrate you the videos. Hello, I'm Shubham. How are you feeling today? Good. Ask to the patient to take a deep breath as possible and hold it for 3 to 5 seconds. Then exhale slowly through pursed lips. Repeat this exercise about 5 times unless the patient seems too tired. If so, stop the procedure and report to the nurse. Place the pillow across the incision line as a bridge. Assist the patient to hold the site or interlace his finger across the incision. Provide tissue and entrust the person to take a deep breath and cough forcefully twice with the mouth open, collecting the secretion in the tissues. You should use the marks when the video use. And thank you for watching the videos. Stay safe, stay home.